Welcome back to Red Zone Talk on 95.3 Olympia's KGY. It is the high school football program. I'm Noel Wall, and with me this segment is Rebecca from Olympia Orthopaedic Associates, and we are going to talk about head injury, concussion, and actually finding out if there is a concussion or not, and that all has to do with impact applications. Rebecca, first of all, welcome to the show.
Thank you. Thanks for having me.
All right, it is wonderful to have you, and tell us, what is Impact?
So Impact is a computerized neurocognitive test that is a tool that our physicians will use to help evaluate a student for concussions.
And this can be done right away, kind of immediate post-concussion assessment.
Right. Usually we encourage the students to do a baseline test before they begin any activities, and then that way there's a baseline established for comparison. And then once the athlete sustains a suspected head injury, then we recommend that they complete a baseline test or a post-injury test.
Post-injury test.
Yep.
So on the baseline, you want to get that done first. That means that you want to go to a facility like yours, like Olympia Orthopaedic, and tell us a little bit about that procedure to provide the baseline.
Yeah, so there's actually lots of groups that provide baseline impact testing. You can find them online, or you can find us online at olyortho.com. You call in, make an appointment. We get you the quick baseline test. It takes about 45 minutes in total, and it stays with you. Patients will get a code, and they can access that and take it anywhere in the country they want.
Wow, that's pretty good. And part of that baseline, I know, is they're looking at eye movement.
So what the impact measures, it measures a couple different things. It measures memory, attention span, and then visual and verbal problem solving.
And so you can compare that in the post-concussion or possible post-concussion assessment. Then you can compare back to what it was in a normal day.
Correct. And then you'll usually find if the patients are symptomatic, you can find where they're having trouble. So if they're having trouble with eye movements, with visual disturbances, you can then start to treat them immediately. So we no longer put the student in a dark room and shut the door and leave them there for 2 weeks. We start treating their deficiencies right away through physical therapy.
Now, I'm sure that, pro teams, universities, stuff like that, they cover all of this. High school may not. If I'm a parent of a high school kid, and whether it's football or whether it's soccer or some of the other sports that you don't think about collisions in, what do I want to do first to make sure I'm ready?
Yeah, so that's a great question. Actually, most of our high schools here in the greater Olympia area all provide impact testing for their athletes, which is fantastic. And there are also places that you can go if you have a middle school child. Again, you can reach out to us at Oli Ortho, or reach out through your high school to get that baseline test. And we actually recommend it for all children, even those that aren't involved in athletics, because there's always a possibility of, falling off a bike and sustaining a head injury. Or
skateboard, bike riding, trip over the dog.
Exactly. That's exactly right.
So Impact is a great tool, but there are some things that we need to make sure we know it's not. It's not a cure.
Correct. We don't have any way to prevent concussions at this time.
Except helmet.
Except a helmet. Yes, that absolutely a helmet is.
Personal awareness.
All of those things, yeah. And then it's just remembering that it's a tool as part of a comprehensive exam. And so, if a physician isn't trained in impact management, then that baseline test and the post-injury test information is just not going to be very helpful for them.
And certainly it's not a substitute for medical treatment.
No, not at all. And it's not a home-based test either. So while you can't access it from your home, it's best to be done under the supervision of a healthcare professional.
And it doesn't hurt to look at your athlete and say, they look a little off or something like that, I better get in.
Absolutely. And, the athletes are always the last to recognize that they're having trouble. So it takes a village to manage a concussion, and that includes teachers who spend the majority of their day with the students, coaches, athletic trainers, and then physicians and parents. So everyone needs to be aware and help those kids.
All right. Rebecca, it's been wonderful to talk to you about impact and the idea of how to really get an idea if a concussion has actually occurred or not. Yep. So thanks again, Rebecca from Olympia Orthopaedic Associates. Have a great day.
Thank you. You too.
And we'll be back with more Red Zone Talk right after this on Olympia's KGY.